My name is Travis Morsoli here with Costa Mesa Physical Therapy. We're going to be going over the dynamic mobility technique using the compression band to gain hip extension. So we're doing a little pre-test here, Thomas test to look at hip extension range. So as we put her down, you can see a significant limitation in extension. So for the dynamic mobility technique to gain hip extension, we're going to use the red compression band as well as a super band, 60 to 80 pounds of force. I'm going to start on the anterior medial hip, wrap around as high as I can get on the posterior side, and then start my tension on the anterior side. And again, tension on the anterior side. Okay, and then the super band goes as high as you can on the posterior hip. Have the patient step back as far as they can into the tension of the super band and kneel. The most important thing to consider with this technique is they're moving in an anterior-posterior direction and controlling the core. So you don't want any of that movement coming out of the lumbopelvic area. You want it all focused on the hip. You're going to do this technique for approximately 2 to 3 minutes and really cue and make sure that that lumbopelvic area isn't moving and it's just the hip. So after approximately 3 minutes, we're going to take the patient out, slip the super band off, and then take off the compression band. Following finishing the technique, we can retest and see the gain of range of motion in extension.